W.
Their gateway into other opiate type medications like heroin was through prescription pain medications.
Dependence, tolerance, and addiction to opioids are causing local doctors to find new ways to treat chronic pain. And they're seeing success. They tell Valley News Team's Veronica Marshall about the alternative therapies that are now saving lives.
I had some experiences with patients where I realized how detrimental opioids were, and it really drove me to try to do something about it. If the gateway into this problem starts at the doctor's office, that we need to change the culture of how we're managing pain.
In the face of a national drug epidemic and new data, doctors are reconsidering how they prescribe opioids for pain management.
We're not seeing that those patients are getting a significant reduction in their pain or significant improvement in their ability to function.
Now they're embracing alternative pain therapies like chiropractic therapy, massage, implantable devices, and acupuncture.
Acupuncture helps release endogenous opioids in your body. If I'm going to have a patient wean off of opioids, it can be a nice tool to use to help that patient not feel as significant effects of withdrawal from the opioid medications.
Another growing field in alternative chronic pain treatment is cognitive behavioral therapy.
We have a lot of patients that we're seeing who are being tapered off of their medications or have been completely off of their medications, which is an additional challenge.
Sessions include problem solving, challenging negative thoughts, and how to talk to friends, loved ones, and medical professionals about your pain. Other sessions focus on reducing physical symptoms.
Just ways to kind of decrease that muscle tension, as that muscle tension can actually lead to increased pain for people.
Psychological therapy can't fully erase pain, but it can help patients learn how to live with it.
Their pain levels now typically go like this because of overdoing it or it's things like that. And in therapy, our goal is to use these skills so their highs aren't as high, so they're able to stay at a more constant level.
At some point, we have to accept that we're going to have some degree of pain, and then we have to be able to deal with that pain in a healthy way.
And while some patients have welcomed the new treatment plans, others have needed some convincing.
There's also some patients that have been resistant to try different things, but with the success that we have with some of these options, they hear about it from their friends or through the community, and they're excited about it.
But experts say to also keep in mind, not all alternative therapies are the same.
Do your own research on that, learn about it, learn what it is, find someone who's licensed in doing that kind of therapy by the state so that you know that it's safe.
In Fargo, Veronica Marshall, Valley News Live.
And another way that some states are combating the opioid crisis is by legalizing medical marijuana in order to deal with chronic pain. Minnesota passed legislation in 2014 allowing some patients to use medical cannabis. Voters in North Dakota approved medical marijuana last November, but the state is still working out the details of how they want to implement that new treatment option.